looking for a place to start my career in medicine, I knew that I really wanted to work at a federally qualified health center. It was really important for me to work at a place where the board was the majority community members and patients themselves. It was important for me to work at a place that really valued the diversity of the patients and had staff that represented that diversity as well. And I think there's a lot that HealthPoint does to support its patients, and some of the things that come to mind is we provide interpretation to all of our patients. HealthPoint provides care on a sliding scale fee in order to ensure that access to insurance is not a barrier to access to care. During my decade of working here, I've seen them add a care support department, an entire department, because for a long time, I think as the providers, we felt like we had to do medical care and social work care, and we don't have to anymore because we have social workers in our clinic now. I think that HealthPoint heard providers spend a lot of time charting, and I don't want to spend a lot of time charting. I want to spend time with my family, and was an early adopter of a scribe program and now an AI scribe program, and my documentation time is significantly less. So I think at HealthPoint, I never feel like I'm working alone. You know, our patients really need a lot of support beyond just the prescription that I can write for them, perhaps. And with the support of our pharmacy team and our interpretation team and our referral coordinator and our insurance navigators, you know, I feel like I'm never alone. I'm always working in an interdisciplinary team to try to provide whatever care and partner in any way we can with our patients. I'm a good example of this, of just like the different avenues that you can take within HealthPoint depending on what your clinical interests are or your leadership interests. I became the medical director of our clinic. That was a great opportunity for me, and I did that for a while through COVID, and then realized that I really wanted to lean into my passion for refugee and immigrant care, and an opportunity arose to be the specialty director of that program, and I was able to step into this other role. So I guess over the last many years at HealthPoint, I've had a lot of different roles, but it's really been an opportunity for me to not only practice clinical medicine, which is certainly really important to me, but also get to, you know, dip my toes in medical education or in leadership. You know, I think that when you're choosing to go into community health, you're choosing to work in an FQHC, you know that your work is going to be hard. You're going to have your work cut out for you, right? There are going to be complex patients, both medically complex and socially complex, and there's never going to be a shortage of patients. So I think that, you know, you come into this work knowing that your mission aligns with the mission of this organization, and you're going to be working hard, but you're going to be around great colleagues, you're going to have incredible patients, and hopefully you're going to have some supports to make that possible.